let me ask you this question. The aim of psychiatry is to diagnose a patient, or is it understanding a patient? If we confine ourselves to diagnosis, then standard ways of interviewing patients are more than enough. We assess symptoms as parts, details of the experience and behavior of our patients, and when we have enough, we attribute that patient to a formal psychopathological category. But does this help to understand the form of life that that patient embodies? Does this help to establish a relationship, a therapeutic relationship with that patient? Does this help to help the patient's neighbors to understand the kind of world he lives in? That's the point. If you want to switch from standard assessment of symptoms aimed at diagnosis to understanding the form of life embodied by a given patient, we have to use other tools. We have to use another method. We have to go beyond mere symptoms, and we have to address the life world of the patient, the world in which the patient lives. We have to be open to grasp the basic structures of his or her life world that are, in principle, not different structures from the structure of our own life world. How can we describe a life world? We describe it through 5 basic dimensions. One is time. I'm not talking of the time of the clock, I'm talking of lived time. The second one is space, lived space. So how do we live space? The third one is embodiment. How do we live our own body? The fourth is selfhood. And the fifth, which is extremely important, is how do we live other persons in social situations. What comes out from this kind of assessment goes much beyond mere symptoms in a given patient. This gives us the possibility to understand how does a patient orientates in his own life world, and it makes sense of his abnormal behaviors, of our difficulties to intuitively understand his behaviors. It makes sense of the reluctancy of persons, of neighbors of this patient to aggregate with him. It makes sense of the difficulties of this patient to aggregate with other persons. This entails that psychiatry is not only or merely a medical specialty, but it is also a specialty that must be sensible to the philosophical and humanistic dimension of knowledge in order to address the issue of the meaning of the form of life of another person. We need to be sensible to the values of that other person. We need to be able to see beyond the negativity of mental symptoms, the positivity of the values that subtend that given form of life. What are values then? Values can be easily defined as a value is what matters to a given person. We have to be aware that what matters to a person affected by schizophrenia is not the same as what matters to me. We have to be aware that what matters to a person affected by borderline personality disorder is not the same as to what matters to me. And this is the same with persons affected by mania or major depression, eating disorder whatsoever. Sensibility to the values of other persons is the only means to establish a relationship with another person. And establishing relationship is obviously a basic step for caring and treating another person. Usually, standard psychiatry speaks of patients who do not want to be treated as non-compliant. This, of course, puts all the responsibility of non-treatment on the shoulders of the patient. But obviously, the case is that the psychiatrist has not been able to understand what matters in the life of that patient. Being able to grasp what matters in the life of that patient is the only way to establish a compliant relationship between psychiatrist and patient.